Hello, and welcome to another episode of the Our Sustainable Warriors podcast, a series where we travel around the world and meet with some of the most innovative entrepreneurs who are tackling some of the most challenging sustainability issues that we face today. In this episode, I'm joined by Tafadzwa, co founder and CEO of Dawa Health. Tafadzwa, welcome to the Our Sustainable Warriors podcast.
Thank you for having me, Nick. Welcome to Zambia as well.
Thank you very much. It's a wonderful place. We've really enjoyed our time in Lusaka so far.
That's great.
So, Tafazwa, could you just introduce yourself? Who are you and why are you here?
Okay, thanks. So I'm Tafadzwa Kalisto Munza. I'm the co-founder and CEO of Dawa Health. We are a health tech company based here in Zambia. We are working on democratizing access to healthcare services, leveraging different technologies, leveraging last mile health workers and mobile clinics. Why we started on that journey, I guess, it's by training. I'm a medical doctor. Why I decided to go into the healthcare system. There are a lot of family background history. My dad is diabetic, is hypertensive as well. So there was a lot of motivation around healthcare issues. Then I delved into essentially coming into the healthcare industry, medical school. Now we're trying to run this startup to just continue pushing and democratizing access to healthcare.
I just want to talk a bit about your decision to become a medical doctor and just find out a bit about what that's like as a Zambian going through medical school, etc., etc. So you mentioned there's some sort of family connections that really drove you towards the medical practice. Could you just tell us a bit more about that, and then just what it's like, studying medicine here in Zambia?
Yeah, okay. So yeah, like I mentioned earlier on, so there was the family motivation to wanting to be a doctor, but I also had a childhood friend. His dad was a medical doctor. So I was like, okay, I think that's something I want to be when I grow up. Then I just started working and striving towards that early on since primary school into secondary school, then got into medical school. Studying medicine in Zambia, it's tough. I think like medical school is really tough, across the world. It's very demanding. I think that's the biggest thing. It's very demanding in terms of time. You need to be dedicated. It's a lot of study hours. You need to work as well with other colleagues. A lot of collaboration. So that was my essential experience from there. Then yeah, during medical school, one of my closest cousins got pregnant, which was the initial spark to us actually starting Dawa Health. So that's how we got to where we are today.
Okay, great. And then when you finished medical school, did you then move into practicing as a doctor?
Yeah, so not really. So actually, we actually started Dawa Health when I was still in
Okay,
medical school as research, as projects. Then immediately after, it was full time now, trying to push Dawa Health. Though I'm
okay.
still practicing at the hospital.
Ah, okay.
Yeah.
And what was it about your cousin's pregnancy that was the real spark for you? Because I imagine, like in most countries, going down the path of a career of a doctor is quite a sort of well rewarded
Yeah.
path in terms of it's a good career to go down. What was it that made you think, no, I'm going to take a much more risky path, which is build a health tech startup?
Yeah, okay. So she had a bit of complications. There's what we call preeclampsia, which is essentially pregnancy-induced high blood pressure. So patients tend to have swollen feet. If it progresses, you can even start having seizures. So it's a very high risk complication. Though she was fine and her baby were eventually both fine, that was the initial spark to how big is the problem around maternal health, around healthcare, what can be done in terms of improving knowledge, in terms of improving access. Then when we did that research, we saw that there was a big gap, across sub-Saharan Africa, with Zambia being, where we are based, in terms of what people have, in terms of knowledge, in terms of access. So that was okay. There's this gap that's exists in the market. Potentially,
Mm.
let's try to tackle that. So that's how it all began.
And just, I guess, for my benefit, as well as the viewers who might not be so aware of what healthcare in Zambia is like, could you just paint a picture of what the conditions of Zambian healthcare are at the moment?
Yeah, okay. So it's divided into, I think, four levels. So there is the primary clinics where people usually first go to. Then for primary clinics, you're referred to level one hospitals. So level one hospitals is where you have the basic clinical officers, basic medical licensures, nurses there. They don't offer really specialized services. There are a couple of level one hospitals, and from level one hospitals you go to provincial hospitals where you might have specialists there. A couple of, if it's outside of the primary Lusaka, then from there you now go to teaching hospitals where you are having medical schools and professors mostly anchored in and trying to pass on the knowledge and stuff. So that's how the healthcare system, in terms of training, in terms of infrastructure, is like. Then there are a lot of gaps in those four levels in terms of what people can attain and services they can get. I'll give you an example with maternal health. We are heavily tackling. Maternal health, they usually have one dedicated day in a week where all antenatal and maternal health services are offered. And because of that, you're finding out that thousands of patients are queuing up for that single day. So patients have to wake up like at 6 in the morning, go to the hospital, queue up. Maybe they get served at 12. They've been there the whole morning. So that's how healthcare is. Some services are there relatively, but it's not the best, comparing to where I've been in the global north. So yeah.
Mm. So you decided to start Dawa Health to combat some of those
Yeah,
challenges and as you say, democratize the access to the healthcare.
exactly.
Brilliant. And in terms of what is Dawa Health's mission? Then?
Yeah, so our mission is essentially focused around decentralizing healthcare. From my experience, some of the challenges we have is because patients are essentially required to come to the health centers. So some essentially the different barriers that exist in the market are things like distance, things like costs, things like I mentioned earlier on queuing up. This essentially might deter some of the patients to not want to seek the services. So what we decided to do with Dawa Health is decentralize access to healthcare. If we get to the community level, we are able to identify some of these patients in time. We may be able to identify risk patients and refer them to the appropriate teams. We might also be essentially leapfrogging some of the existing barriers, like costs, like distance, like lead presentation to the hospitals. So those are some of the things we are trying to essentially overcome with Dawa Health.
And can you give us a bit of an example of the types of services that communities can get access to through Dawa Health?
Yeah, okay. So at the moment, we're offering services around maternal and child care, all the range. So from fertility to antenatal to postnatal to under fives, we offer all services around there. So from things like point of care tests, like your HB levels. Additionally, now we've integrated e-pharmacy services into the platform. So let's, for example, we triage a mother in the community. We find that they're anemic and they might need blood boosting, then they're able to order the necessary medications over the platform, like your folic acid and your iron sulfate. So we offer all those services around maternal and child healthcare.
And you're very focused on the healthcare for children side of things. I was just interested, what are things like the birth rates and the child mortality rates like in Zambia? How do they compare to, say, other countries in the region?
Yeah, okay. I'll give you an example of maternal mortality rates. So for maternal mortality rates in Zambia, about 8 or so mothers die every day from preventable causes. If you compare with the global north, for example, in Finland, only about 3 mothers die per 100,000 births. Whereas if you compare to Zambia, that's about 270 deaths per 100,000 births. So the comparison is very significant in terms of how many mothers we're losing locally. And in terms of the birth rates, they're quite, I'm not specific with the numbers, but they're quite higher because of the pregnancy rate we get in sub-Saharan Africa and across Zambia.
Yeah, so I think that's 90 times more deaths
Yeah,
in Zambia than there are
yeah,
in Finland, which is,
yeah,
is, is quite a big gap.
big gap.
Yeah, for sure. So let's talk about cost. I think one of the key things when it comes to access, there's I guess the logistical element of it, which is can you get to the place where you can get healthcare, but then there's also the financial element of it as well. Dawa Health is a for-profit business, so how does that business model work?
Okay, so we have a very interesting business model. So how we essentially, because of the model we have, we're able to really cut down the cost of acquisition of the customers and the cost of providing the services. So our costs are very comparable to the government costs in terms of we charge the same if you go to a local clinic or if you come to Dawa Health. But with Dawa Health, we are coming to where the patient is. So we are really decentralizing healthcare in that aspect, that you maintain the same cost, but actually getting equally or better services through our model. So that's how we essentially offer that. We charge per consultation with the clinician, which enable us to also provide income for those same clinicians we work with. Then we are able to offer other point of care tests that you still need to pay at your local clinic or at a hospital, but we're doing it as point of care. So that's how we do it.
Let's pretend that I'm a potential new user of Dawa Health. What kind of what would I have to do in terms of to get access to the Dawa Health services?
So it depends with the channel you essentially heard about Dawa Health from. So it could be a community healthcare worker. So we work with a lot of community healthcare workers. So these are people that are integrated into different communities and different societies. So they essentially go there, evangelize the service. Then you might get interested to say, okay, I want to join Dawa Health. Then they'll essentially link you to our platform or to our clinicians. Then that's one way you can get registered, or you can see an ad running on Facebook. Facebook is really big here in Zambia. Then you sign up through Facebook, directly takes you to our bot or to our website. Then you're able to sign up. Or when we're running an open air clinic, you might see the van in the community. Then you approach it. Then that's how you come into the system. So those are all different channels a patient can come to Dawa Health.
So yeah, it caters for, and I guess this goes to access again. It caters for people who, I guess, have access to smartphones because there's an app, but then there's also people who don't have access to
Yeah,
smartphones, but they can still get
access
access
to the
to Dawa
services.
Health
Yeah.
through the right channels. Um, okay, great. Now, looking forward, you've started, um, focusing on maternal healthcare, focusing on children and the youth. What do you see for the future of Dawa Health in terms of, firstly, the services that you aim to provide, and then the impact that you want to have on some of the things we discussed earlier? The number of mothers that die every day from birth, or the birth rates.
Yeah, okay. So I'll start with potentially the number of services. So we're already in the pipeline of starting to expand our service offering, because with some of our open air clinics, we've realized that some of the patients who come to access those services are not necessarily pregnant women or under fives. They are people with maybe diabetes, people with hypertension, or these causes. So we want to start offering full-fledged outpatient services in the communities. So this range from chronic conditions to any basic illnesses that might come. Then in terms of the impact we want to have, we want to significantly reduce maternal mortality in the communities we work in. Some of our technology right now is able to predict some of the high risk conditions, things like postpartum hemorrhage, preeclampsia, which are the leading causes of maternal mortality in sub-Saharan Africa. So once we onboard you onto our platform and we're able to identify that you're a high risk patient, we then refer you to the appropriate channels in time, then essentially curb maternal mortality. So we want to significantly reduce it from 18 a day to zero, ideally, right?
Mm.
But we know that there might be other external factors that come into play, which might make that a bit difficult. But we want to get it to zero as close as possible.
So it sounds like in 10 years' time that you hope that the maternal mortality rates in Zambia will be as low as, or similar, or even less than a country like Finland.
Yeah, potentially. The World Health Organization essentially ideally wants maternal mortality rate across, the world to be under 70 per 100,000 beds. And in Zambia, we still have them close to 250. So we are hoping we can get them to as close as zero as possible, right? Like I mentioned, there are about 8 mothers who die daily from preventable causes in Zambia. And with our work, we now have some of the predictive technology and the decentralized care. We hope we can bring it as close to zero as possible. And we also intending to starting setting up our network of clinics and hospitals eventually, where we can have the full-fledged logistic referral system from the community to the last mile care of services. So that's the ideal plan potentially in the next 10 years.
Yeah, and I just want to pick up on that, the setting up of your own clinics and hospitals. What is that? What is the process like in Zambia? Is there regulation you have to go through? I'm assuming there's quite a lot of financial cost that goes into setting them up. Yeah, can you just talk us through what that process would be like here in Zambia?
Yeah, okay. So the regulating board across the healthcare system is the HPCZ, Health Professional Council of Zambia. So they regulate both the training, essentially disbursements of services, and the regulator of the health workers. So the requirement is obviously to be registered with the patents PACRA, which is essentially Patents and Company Registration Agency. Once you're registered with that, then you take that to the Health Professional Council of Zambia. Then you need the right team. So, for example, in the maternal space we work in, you need qualified clinicians. So this could be a medical licentiates, medical doctors who can be the supervisors to clinical officers. We have a special cadre of health workers called clinical officers in Zambia. They're kind of between nurses and doctors who are really trained in large numbers. So you can have a health center that runs that kind of cadre, but you still need the supervising teams who will be medical licentiates, medical doctors to setting up. And it also depends with other services you might want to have. For example, if you want to have pharmacy services, you would need a licensed pharmacist. So it depends with the kind of service a center or a hospital wants to have. That depends with what HPCs that will require out of them. Then also you obviously have to be registered with the revenue authorities for tax purposes.
So it sounds like there's a lot going on there, a lot to do in terms of the regulation side and setting up the hospital. What do you see as the biggest challenges that you're going to face in the next 10 years with, sort of setting up the hospitals and really putting in structure and processes that can help you achieve the impact that you want to achieve?
I think one of the biggest challenges is with what we've learned, adoption of some of these technologies, right? There's a bit of a learning curve from people walking into a health center to start using all these digital tools. So there's need of good sensitization and essentially mass sensitization, mass marketing that will essentially help the communities understand the path we are walking down. We're trying to leverage digital technologies and technology in general point of care. So there's a learning curve there. That's one of the challenges that exist. Another one that obviously exists is systematic, which is we need appropriate referral centers. That's more on the Ministry of Health side of things. If we identify some of these complications, we need to refer them to the right channels. But if the infrastructure doesn't exist, maybe the technology, as in mobile service providers, don't have service coverage in that area, that will be a challenge because we're digitally leveraging a health center or technology platform. So we need service to be available. So those are some of the challenges that exist. Some of them obviously would be financial. This takes in a lot of capital to set up all this infrastructure and this network. So finding the right investors who believe in the vision and the mission we are on, I think that's very key as well. So I think those are some of the challenges we anticipate to face over the next couple of years as we try to expand our service across Zambia and obviously across sub-Saharan Africa.
So I'd like to just turn the conversation a little bit towards more generally what it's like being an entrepreneur here in Zambia and what advice you would give to young aspiring entrepreneurs.
Yeah, so the ecosystem is definitely growing. If you look what Zambia was 5, 10 years back, it's totally different today. More entrepreneurs are getting into the market. We're having a bit of more success stories. We have one successful Y Combinator company that has raised millions in the last couple of years. So more people starting to get into the entrepreneurship space, all right, because of the opportunities that are there. But the ecosystem is not as big as other markets across Africa. Investors are starting to get interest into the ecosystem, which is definitely good for the next aspiring innovators or entrepreneurs. And obviously, entrepreneurship is hard. It comes with a lot of challenges. You need to set up the right teams. You need to have the right resources, and there's a learning curve essentially because most entrepreneurs are coming from either being employees or being professionals. Getting into the entrepreneurship space, there's a learning curve there to understand what a market cap is, what a cap table is, all that. You need to start learning all those different things. Maybe you're a medical doctor, you need to start understanding finance what are the projections, cost of acquisitions, all that. So it comes with a lot.
One of the observations that I've made since coming to Osaka and Zambia is I think it's a bit of a hidden gem when it comes to the entrepreneurship ecosystem, through my experiences with Startup Lounge Africa and through, being able to travel around East and Southern Africa with the Our Sustainable World series. We get a lot of exposure to different ecosystems, and definitely I think maybe when investors outside of Africa think of Southern Africa, they just think of South Africa.
Yeah.
And as we know, that gets a lot of attention from investors when it comes to Africa. And Zambia is maybe slightly overshadowed, or slightly unfairly overshadowed by just being so close to South Africa. And I think there's a lot of potential in Zambia for sure, based on
Yeah.
what I've seen, the entrepreneurs that I've met in only a week time. So yeah, definitely agree that Zambia is one to watch.
Yeah, definitely. I think the ecosystem is growing, and we now have the government is putting in a lot of effort in terms of making sure that the infrastructure, in terms of regulations, it's good for investors. So I think that will go a long way in helping the ecosystem continue to grow.
Well, Tafadzwa, thank you very much for your time today. It's been quite windy, and we've been slightly distracted by the flying banners behind us, but it's been a great conversation. Thank you so much for your time and for agreeing to be part of the podcast and, of course, your Sustainable World series.
Yeah, thank you, Nick, for coming through and sharing our story as well. We want to continue working and inspiring others, but continuing impacting the community we are in. So thank you very much for coming to Dawa Health.